Second.
All in favor, say aye.
Aye.
We have an amendment on Senator Prentice's bill. We have an amendment on Senator Prentice's bill 696. It replaces all after the enacting clause with a study commission. Everybody should have seen it. Do we have a motion?
Should I move ought to pass on the bill so I can move ought to pass on the amendment?
Okay, Senator Whitley moves ought to pass on the bill and moves the amendment 696 ought to pass. Is there any discussion?
Senator
Think
Prentice?
this is a good resolution.
I'll second those.
Okay, Senator Gray seconds it. All in favor, say aye.
Aye.
Any opposed? Senator Whitley, you get the honors.
Great.
Okay.
So, Senator Bradley, we only just vote on the amendment. We still have to vote OTPA.
Oh, I'm sorry. You're right. I'm in such
I
a
move
hurry
ought
this
to pass
morning.
as amended.
Senator Whitley moves ought to pass with amendment, seconded by Senator Gray. All in favor, say aye.
Aye.
Aye. And now Senator Whitley will get the honors.
Great.
Okay. We'll come out of executive session.
Move to come out of executive session.
Second.
Okay. I'm going to open the hearing.
You said Whitley's taking that one off?
Yep. On Senate Bill 458, Senator Daniels' bill. He'll be walking in the door in a minute. Perfect timing. Senator Daniels, you're up. So while he's getting seated, I hope everybody knows we have session at 10. We're done at 9:45. So with the exception of Senator Daniels, I'm going to strictly enforce a time limit of 2 minutes. And if we have more time before we have to leave at 9:45, I'll give people a chance to talk a second time. Senator Daniels.
Morning, Mr. Chairman, members of the committee. For the record, my name is Gary Daniels. I'm State Senator from District 11, encompassing the towns of Wilton, Milford, Amherst, and Merrimack. And I'm also the sponsor of Senate Bill 458, which came out of a requirement of House Bill 2 that we passed, established a study committee to study the closure of the Sununu Center. I also chaired that particular committee. You should have in your possession the final report that came out of that study committee, as well as a link should have been provided to you of the 170 some odd pages of documentation that we received over multiple meetings on that. What came out of that is not a consensus of the 5 people that were on the committee, but 3 different proposals. And let me say that there were really 2 things I think that came out of House Bill 2 that we concentrated on in the charge of the committee. And that's number 1, that we were looking for a replacement for Sununu Center that would hold 18 people. And secondly, that it had to be something that could be in place by March 1st, 2023. So those are the things that we focused on. What came out of the committee were 3 recommendations. One of them was that we just renovate the property and basically have a mini Sununu Center. Secondly, was that you would build another facility on some state-owned land, which would require at least 10 acres of land. And the third one was that you would use existing private accommodations that would be run by DHHS. And to meet the March date, the only one that was viable there was to use the existing things. And I know that there has been some word going along about privatization. And while we're talking about using private facilities, I want to stress that this is something that would be under the control of the state. So they would be setting up the guidelines, much like they do when they contract out now. They contract out for services with many, many different private organizations to perform the services, but it's still under the control of DHHS. So with that, we were proposing to use facilities that were existing. We recognized that one of those facilities would need to be modified or hardened, I guess is a word we could use, so that if you had youth in a residential environment, which is another thing I will say that everyone seemed to agree on, that we needed to provide not an institutional environment, but a residential environment, and that seems to be the way things are going right now, and it's been effective in other places. But you may run into circumstances where in that residential setting you have someone who starts beating up on staff or something like that. Right now, they would take them and send them to Sununu Center. So what we'd be proposing there is that there would be a separate facility that would be more secure, more hardened than the others, so that there would be the place for those individuals to go. I don't want to spend a whole lot of time repeating what you can already or may have already read in the report. So I'd say it might be more productive if you have questions. I'd be glad to answer those questions. And let me just say that there were certain things that the committee, while we didn't come to a consensus on necessarily what route to go, there were a number of things listed in the report, the final report, that indicated that we did agree on. One of those was a report by Alvarez and Marcel, which again focused a lot on the residential type things, and
Senator Whitley.
Thank you, Mr. Chair, and thanks for taking my question, Senator Daniels. So, what I'm really concerned about going forward, or what I really want to focus on, and I think is important for us all to focus on, is how do we prevent, going forward, what has happened at the Sununu Center in the past. So, we know that institutional settings are ripe for potential abuse. This has been decades and decades. That's why a lot of institutions are closing, right? They're just ripe for abuse. And even in New Hampshire at the Sununu Center, there have been horrifying reports about sexual, physical abuse on children. It's devastating that this happened in our state for decades. And so my question is, and maybe this is just something that we need to keep talking about, is how do we prevent that in the future, right? As we're thinking about, how we're going to best support these children, how do we prevent that in the future? And then how do we prevent, this from going on so long in an institution that was so troubled, right? And I think because it was run by the state, do you think that because it was run by the state, there was less oversight? I'm wondering on your thoughts about how to prevent that in the future.
No, I think it's a good question, but I'm not sure if there really is an answer, because really what you're talking about is human behavior. And I'm sure when those individuals were hired by the state, they had background checks done and everything looked fine. Whether there needs to be more frequent monitoring of things or such, I'm not sure that there's any difference between the proposal that's being put forward by the committee versus what we have now at Sununu Center. I think we try to get the best employees that we can. I don't think we certainly know that somebody has a background like that and then still put them in that type of position. So it's a hard question, but I'm not sure that there is an easy answer to it.
Thank you very much, Senator Avart, sorry.
Thank you, Senator Daniels. Just curious, if we were to build a new facility, how long would that take?
I think you're probably talking at least 2 years. Because, I mean, the proposal goes through not going through an RFP the first year because of the timing of it, but then on subsequent contracts after that, that you would have. If according to DAS, you know, there's a whole process you have to go through with the RFP and the building of it. I will say that there seemed to be consensus among the committee and I would say those in attendance that the preference be that we not have something on the current property in Manchester.
Well, yeah, with regards to the system of care, you know, how is that any different than a privatization running the whole organization? Is it any different?
I don't know that it really should be. I mean, you've got different personnel. You know, the individuals may be private people as opposed to state employees running it. But again, you know, we tried to make sure that it was structured so that DHHS was in charge of this. So the people doing the work would end up having to follow the same rules, the same procedures, same guidelines as an employee would of the state. So I would expect that there really should be no difference.
Thank you.
Thank you very much.
Thank
See you
you.
across the street. Representative Walner, you haven't signed up. Do you wish to speak? Okay. Representative Kirk?
Thank you, Mr. Chairman. Good morning to you and members of the committee. For the record, I'm Neil Kirk. I live in Ware. I'm representing myself, but I was involved and have been involved in this issue since 2016 when I was a state representative. First, the closure of Sununu, which is mandated by House Bill 2, is part of a long-running approach that we have to children. In other words, take children out of institutions and treat them in the community, just as we've done with mental health by closing the Laconia School. We don't need another mini Sununu of 18 beds. It's inconsistent with our whole approach to how children are to be treated in the community in home-like settings, generally operated by private nonprofit organizations under contract with the state. We're talking about, in House Bill 458, a secure placement facility run by a private nonprofit, providing the kind of treatment we expect for children. It's more cost-effective than having the state run it, and that's because at a private institution, you pay per bed, per day, per child. It's a variable cost. So, for example, if we only have 6 children, which is likely, especially if we pass House Bill 254, so the population would drop from its current level of 12 to around 6 or so, it would only cost us roughly $4 million a year for those children in a private facility. But if we had a mini Sununu, a state-run facility, the costs are fixed. You always have your 63 employees, Mr. Ribson's suggestion. That will cost us roughly $8.3 million a year. So if the number of children drops, we'd save $4.3 million a year. Plus, it is possible, not guaranteed, but possible, that this community facility would be Medicaid eligible. Definitely not the case if we have a mini Sununu. So if you want to do something good for the children, and if you want to do something good for the taxpayer, House Bill 458 is just the right solution. One other point before I stop. There's $1 million in here to help the private facility do capital expenditures. The fiscal note suggests you need $10 million to build a replacement facility, and that's true if the state were to build it. But when you deal with a private entity, They build it, they fund it, and they charge you for that funding through the daily rate, basically depreciation. And so that's built into the rate. I use $1,750 a day as my rate, which is between the $1,600 and $2,000 that Mr. Ribson in the fiscal note call for. So $1 million is probably, may not even be necessary for the private facility, but it's in there just in case. This is a good bill, folks. I hope you can pass it. Thank you.
Thank you very much, Representative Kirk.
Thank you, Mr. Chairman. And without disrespecting the committee, I would leave because under the Senate rules, that will leave a chair for someone else.
I would just say this before you leave the room. Representative Kirk was always the epitome of manners and graciousness in the House, so he hasn't forgotten that.
Thank you, Mr. Chairman.
Yeah, don't forget your jacket, Neil.
Yes, I did last time.
All right, Mr. Ribson.
Good morning, members of the committee. Joe Ribson, Director, DCYF. Thank you for hearing from me today. I'll try to keep it brief, as Senator Bradley has requested. The department and the legislature and many in the state have for a long time been trying to figure out what is the right thing to do with SYSC and with the need to commit and detain some youth in the state. Couple preliminary things I would say. Children who are committed and detained in the state, that's not at the decision of DHHS, that's at the decision of courts by matters that are brought by prosecutors, either law enforcement prosecutors or DAs or Attorney General's office, but it is not a decision of DHHS who gets committed or detained at SYSC. The average daily census at SYSC over the past year has been 12, down from well over 60 when I got here just 4.5 years ago. But we have seen that census dip over 12 at times and dip under 12 at times. So it's been as high as, say, 15 or so in the last couple months, as low as 8 in the last year. What we put forward as a recommendation was published in September of this year. What was referred to other folks today as the A&M report, the recommendation was to create an 18-bed facility which is designed to be therapeutic programmatically, clinically focused programmatically, and to have the building structure itself complement that modality. The current SYSC structure, the building structure, is very correctional in feel. It's very spread out. It doesn't really allow for that type of feeling and approach. Some of the key things you heard today already, though, that I think were perhaps a little incorrect, that I want to make sure we clear up on the record. Number one, Medicaid is not, by law, ever an option for a facility that's used to detain and commit children. There's no option to do that anywhere in the country. Many states have tried. It does not happen. Two, the idea that a private facility is going to come in and pay millions of dollars to build something and then build a daily rate, I think is untrue. Vermont is going through this exact same process after they closed their facility with no plan. They've still not been able to get that new facility built, and their plan is to give the provider millions of dollars to build the facility for them, not that the facility is going to front those costs. What Vermont's doing instead is sending their children to us here at SYSC, which is definitely a short-term solution for them and a short-term arrangement for us. The most important part of this, though, is that at the end of the day, this facility has to have that treatment and clinical modality and focus that we discussed. The bill as written now includes 2 pages of definitions that sound like it talk about those things, but the actual requirements include nothing around the clinical or treatment modality that's to be used in the program. The bill that's here before us today talks about, in one section, 6 beds, 12 beds, 18 beds, not quite clear what the population is that we're talking about. It makes distinguishes between a hardened facility, which has exterior locked doors, and a secure facility, which does not have secure locked doors. I do not believe that a facility that is not architecturally secure is what the state has in mind, but as written, this bill actually would not have any secure locked doors on the exterior. Lastly, a lot of conversation today about distinguishing between a publicly run and a privately run program. When we contract with the provider, I consider that to be a privately run program. We do contract, we do oversight. One of the things that I think is really, really risky about building this one facility in the entire state for detained and committed youth as a privately run program is that if something goes wrong, as we've seen in other privately run residential programs, and it has to close, there is no backup plan. At DHHS, we have had to in the past couple of years, and we would continue to pull in other folks to make sure that the doors stay open and that kids are treated and the kids are kept safe. We've had to do that through COVID. We've had to have JPPOs, child protection workers, come in and work shifts to make sure that happens. Privately run programs, we've seen them have to close down in situations like that. Limit admissions, all of those things that you cannot do when the court's ordering you to take detained and committed kids. So for all of those reasons and a lot more that I'm sure you'll hear more about from our other folks, particularly around the clinical and treatment nature of this program, we do oppose this bill as structured, and we do think that there is a better path forward for meeting the needs of detained and committed youth in the state of New Hampshire. And with that, I'll gladly take questions.
Senator Whitley?
Thank you, Mr. Chair, and thank you, Joe, for taking my question. So you probably know what I'm going to ask, and it's related to all the other reforms that are going on. So, you know, you have been an integral part of the reforms in SB 14 to, you know, support these children in crisis before they get in crisis. So I'm wondering if you have a sense, if you could tell us about, you know, the need for what we're talking about here as SB 14 is fully implemented and we are moving towards a true system of care that's community-based. So what are your thoughts about, you know, the census, the need for this type of setting, and how fast we can get there? Because I think that, in my opinion, and tell me if you disagree, we need to figure that out before we build something brand new.
So, and I think that's one of the key points we talked about at the committee that met in the fall, but there was a deadline associated with the planning on this and folks wanting to move quickly. The system of care, and I speak from experience in New Jersey where we built the same thing, full realization of what that means for the census on a deep end facility like SYSC is many, many years away. And the reason for that is the real benefit from the system of care is the kids who are little today who are going to grow up with a different experience and different supports than the kids that are currently entering a facility like SYSC. Getting to those things early before the damage is done is what actually reduces the census massively in the long term. In the short term, I do expect the census is going to remain somewhere around 10 to 12. And with a census of 10 to 12, you do need to have some flex space in your facility. The reason for that is we have boys, we have girls, we have to keep them separated. Sometimes you have one girl, sometimes you have 6. You have to find a way to keep those units separated, keep those folks separated. Oftentimes we'll have boys who have different treatment needs who can't be together, so you have to have ways to keep them separated. Oftentimes we'll have boys who come into the facility with court orders that are requiring that they be kept separated, so you can't keep those young boys together. So you need to have some flex space in your facility, but honestly, at this point, I'm thinking 10 to 12 is probably what the average daily census will be for the next few years, and we'll probably see it continue to decline over time. That's one of the reasons why at the committee in the fall, I shared that I thought whatever we built has to be built in a way that it could be used for another purpose afterwards, so that if we find ourselves in a place like we find ourselves today with SYSC, that whatever it is we build isn't just left for dust, but rather something that could be used for another purpose. Building this around a residential clinical model as opposed to a correctional model would allow it to be used as, say, a QRTP or as a PRTF or another type of high-end mental health facility if it's no longer needed for the purposes of commitment and detention. So that's, I think, one of the key pieces of it. The other key piece of this is that you have to build the utilization of a program like this within the context of everything else that you're building. I talked about the decrease in census over the last few years. Some folks have attributed that simply to one piece of legislation which reduced the types of crimes that can go in there. I would say that is not the leading driver of the reduction in census, in my opinion, and that the bill that's being brought forward this session on the same topic, in my opinion, is also not going to drastically reduce the census. What does drastically reduce the census is building out the appropriate alternatives for kids and having our stakeholders understand that kids' needs are best met somewhere other than a secured facility if possible. And that's why we have less kids at SYSC today primarily. I do not believe it's because of the changes that were made over the juvenile criminal code.
Senator Abard?
Thank you, Mr. Chair, and thank you, Mr. Ripson. Under the integral part of reforms that you brought up, I'm curious as to how many investigations you've had into the DCYF situation that we have currently right now.
DCYF as a whole, SYSC,
SYSC, I apologize.
SYSC. So there are more historical allegations that have been brought forward than I can count, dating back to 1965 through the mid to late, aughts. There are tons of them. I don't know what the numbers are, but that's the program that was in place is not reflective of the program that's in place today, and nowhere close to the program that we're envisioning going forward.
Senator Gray?
Yes, you have confused me on the population. Your population said 12 plus or minus, but you've also testified that Vermont is sending kids here. I want to know if the population of 10 to 12 that you just talked about includes those, how much is, or how many are coming from Vermont, and how we figure out how much to charge them and what do we charge them.
Yep.
So, a whole bunch of questions.
Sure, I can answer all of those.
But you did mention New Jersey already, so
Sorry, I'll try not to do that again. Every time.
We know.
Every time. So Vermont, the numbers that I gave do not include any youth from Vermont. We keep that separate when we do our average daily census for the purpose of reporting to the legislature, state fiscal committee, our dashboards and everything else, because we were asked to keep them separate for the very purpose that you brought up, that it would confuse this issue. For the last few months, we have had 0 kids from Vermont. We had to close admissions to that program because we had our own staffing and COVID challenges. Because the COVID challenges are now receding and because staffing is more stable due to some activities over the last couple months, we have been able to last night tell Vermont we could start serving a couple kids again. So hopefully we'll have a couple kids from Vermont. That does help with the fiscal problems down there. The daily rate that we're charging them, I think, is just under $1,700 a day for the facility.
Senator Whitley?
Thank you, Mr. Chair. So the other concern and question that I have is similar to what I expressed to Senator Daniels. Any institution has the potential, is ripe for abuse. Again, this is like why organizations like the Disability Rights Center are funded by the federal government, because institutions, we just know that it's ripe for abuse. So and this is particularly like troubling when we're talking about children, our most vulnerable children.
Right.
Like, these are the kids that have experienced the worst trauma in their life. These are the kids that have the highest incidence of behavioral health needs. Like, these are our most vulnerable kids. They're difficult kids, no doubt. They have difficult behaviors. We know that. But when we're talking about, where to put these kids, my concern is how do we, provide the necessary oversight, those mechanisms, because there's a conflict when it's run by state government. I mean, I think we can agree that there is a conflict there in terms of oversight and revealing these levels of abuse. What can we do in the future to put those protections in place so that our most vulnerable children aren't being subjected to physical and sexual abuse?
And I think what you actually see is that we as a state have already put most of those things in place. So within the facility itself, there's a few things that you do. You install video monitoring. We installed new video monitoring a couple of years ago, finding that the original system that was put in when the building was built was insufficient, left too many blind spots. We now have very clear video monitoring of every inch and corner of that building, with the exception of private bedrooms, which staff are not allowed to enter, and if they enter, we could see that on video, with a handful of bedrooms that are cameraed for when you're watching children who have, are at risk of suicide or risk of other self-harm. And bathrooms, we have a lot of private bathrooms in the facility. We only monitor the outside of the doors, not the interior of the doors. Next is around staff training, understanding of de-escalation techniques, having adequate staff and multiple staff with kids at all times so that staff are seeing what other staff are doing, having regular supervisory rounds and having higher level supervisors who are in the facility constantly to make sure those things are going well. One of the biggest things that we've done, however, those are all things you do internally to try to monitor for these types of things. One of the biggest things we've done, however, is create an Office of the Child Advocate, which was created here 4-ish years ago. The Office of the Child Advocate has real-time information to everything happening in that building. They have access to our case management system. When alerts go out, when they come to me, they go to the Child Advocate. The Child Advocate has the ability to go into the building, talk to kids anytime they want. In fact, oftentimes they're down there running programs with the kids, working with the kids on a regular basis, as other outside entities do as well. That level of connection to oversight does not exist in any of the contracted programs in the state. I'm sure Dr. Neal can speak more about that, but I think that when you talk about the risks of residential care, I would say those risks are not just limited to state-run programs. And if you look around the country, many of the things that have happened have not been in state-run programs. They've been in privately run programs. And if the concern is around oversight, I think we've already built a very strong oversight mechanism outside of DHHS that has the ability to see into programming in a way that no other entity has ever had prior to 4 years ago.
Senator Avard?
Yeah, I hate to ask it, but we have a $100 million lawsuit somewhere, right? Was that under state or was that under private?
It was under state over 3 or 4 different state governmental structures. The SYSC sat in DHHS, sat in DCYF, sat as its own department, sat as its own division, lots of different leadership, lots of different things. What I can tell you is that that is not happening on my watch. That's not happening today, and it's not going to be happening in the program that's moving forward.
Okay. Thank you, Joe. Sorry to rush. Representative, you hadn't signed up, but do you wish to speak?
Oh, I thought I had signed up over there.
That could be a second sheet.
Do you mind?
Yeah,
If I
no,
go really
please.
quick, I have a post session today. And I am a woman of few words, so. All right, so, good morning, Mr. Chairman and members of the committee. I'm Representative Kim Rice, Representative Hillsborough 37. I was also a member of the SYSC Closure Committee. During the Closure Committee hearings, we heard several times that incarceration is not in the best interest of children. We were told many times that children are better served in home-like settings using trauma-informed, evidence-based treatments. Our main focus should be what is in the best interest of the children and what will provide the best outcomes for these kids. We need to be setting them up for success, and I believe that SB 485 does just that. DCYF estimates that 75% of the children at SYFC have behavioral health issues. The system of care passed by this committee in 2018 has received more than $30 million in appropriations. The system of care was developed to help New Hampshire children succeed. Many children at SYSC should be treated in the children's system of care to help them succeed. SB 458 accomplishes just that while still providing security and safety for the public. I would like to also point out that SB 458 is the only plan that meets the closure date set forth in HB 2. I ask that you support SB 485 so our most vulnerable youth have the best outcomes possible. Thank you.
Thank you, Representative Rice. Next, I think they've asked to testify together, Mr. Kuning and Ms. Rosenberg. Well, let's just get Ms. Rosenberg up here and keep moving along.
Taking our valuable minutes.
Right. Good morning, Mr. Chairman, honorable members of the committee. My name is Jake Berry. I'm the Vice President of Policy at New Futures, and I'm going to join my distinguished colleagues here, Keith Canning from Waypoint and Karen Rosenberg from the Disability Rights Center. We work together as part of the Juvenile Reform Project, which also includes New Hampshire Legal Assistance and the ACLU of New Hampshire. As you may know, our Juvenile Reform Group has worked for years to advocate for the closure of the Sununu Center, and we certainly maintain our position that the center must be closed. That said, we're here today to express our shared concerns about SB 458 and the negative impacts we fear this bill could have on these youth, their families, and our state as a whole. Karen and Keith are going to go over our concerns in more detail, but to put it simply, we fear that this bill does not allow for the time or the structure to close this facility responsibly and in a way that ensures the supports these families and youth need to ultimately help them reintegrate into our communities. With that, Keith and Karen, you guys want to take it from here?
Good morning. I'm Karen Rosenberg, Policy Director at the Disability Rights Center. I prepared 5 minutes. I'm going to keep it to 2, which may mean I'm a little disjointed here. I'm here to talk about how privatizing juvenile detention and outsourcing some of our most vulnerable kids actually jeopardizes their well-being and is a very bad idea. National reports indicate that private facilities use dangerous restraints at alarming rates. And there are current lawsuits and reports of abuse in both private and nonprofit operated facilities that are ongoing today. There's a facility, 6 facilities run by Devereaux, a nonprofit, that's being sued with allegations of sexual and physical assaults, failure to report child abuse, negligent hiring of unsuitable staff, and willful lack of supervision. Just 2 days ago, the Salt Lake Tribune reported an article about a child who died in a residential treatment facility that was privately operated. That facility is now having its license suspended while they look into the allegations that they didn't provide appropriate medical care. So we're very concerned about privatization. Senate Bill 458's backup plan, sending kids to neighboring states, really is not a practical solution. It's my impression and understanding that there are no neighboring states that are able to take our children, so we're looking at sending them to really far-flung states where there really isn't much oversight. Currently, our Office of Child Advocate receives real-time reports of incidents that occur at the Sununu Center. That continues under our current system of having a state-run facility. That kind of oversight does not exist with privatization. We should focus not merely on closing a building, but as Representative Rice said, on trauma-informed, evidence-based care in a way that keeps our children safe. And what this bill doesn't do is actually require evidenced trauma-informed care. It doesn't require it anywhere. It defines it, but doesn't require it. And we have been in conversations, as you know, Senator Bradley, with the department about this, and think we can come up with a way to both provide some extension, which we feel terrible about, but also ensure the health and treatment needs and safety of our kids are met. And I'm going to turn it over to Keith, and I hope I was less than 2 minutes.
So good morning, Mr. Chair, Senators. My name is Keith Kinney. I'm the Advocacy Director at Waypoint. I will be brief also. So you've heard who we are. You've heard how we disagree with the current bill. Let us tell you what we think the solution is. We would support, as a juvenile reform project, extending the closure date of SYSC until 3/24. This gives the department nearly 2 years to be able to do all the things that they need to do in order to make the transition to a new facility. We believe that they should continue to implement the therapeutic treatment model that they've already started, but keep that date as it is, that it should be fully implemented by 3/23. And then we just believe that there should be benchmarks and markers along the way, that there would be quarterly reporting to House and Senate HHS and House and Senate Finance, so we don't find ourselves here again in 2 years. So that seems to us like a very simple solution. It seems a way to protect the children. It doesn't involve privatization, and we think it's the best outcome for a delay that in many ways I think was COVID-related, and we think this is the best way going forward. So I'll end my testimony there, and if you have any questions, I'm sure all of us will be happy to answer.
All right, so just to be clear, the elephant in the room is the date of March of 2023. We know that. We had a conversation last week. You told me you would support June of 2024, and here you are at March of 2024. What is it?
Well, so we had put that, quite honestly, Senator, we support 3/23, but we said, we actually put in the writing that we had down that if it needed to be extended to June of 24, we're fine with that. So we're fine with June of 24. I quite honestly believe they're probably going to need the extra time in the spring to probably do the final things they do. If it's closed by June of 24, we're perfect with that.
Okay. Other questions?
Yeah.
Senator Whitley.
Thank you, Mr. Chair, and thanks for taking my question. I'm wondering if you folks had a sense about an answer to my question for Director Ribsum about what capacity we should be building here. Now that we're building out the system of care, he says, look, we need to build for a certain amount of kids because the kids that are actually going to benefit from the system of care aren't going to, be there where we need them for a couple of years. So what's your sense about what we need for capacity and how long it's going to take to build up this community-based system? Because I am concerned about this whole notion of building a new facility that's obsolete, spending a lot of money. If you build it, they will come. This whole thing that we know, it's just this on repeat over and over again. Like, what's your opinion, all of you, about the capacity?
Okay, if I go. So, I think we have to, thank you for the question. I think we have to remember we're going from a facility of 144 down to 18. So
when it was built was unnecessary. When it was built was unnecessary. That's the problem.
Yeah, and I would say that there's disagreement about the exact number. I think the reality is that I think as Director Ribson has said, is that, no one can see into the future. I think the police are terribly concerned that there might be a period or something happens where we have to detain more kids. We were hoping for something closer to 12, but quite honestly, Senator, if in the end they have to live with 6 beds that aren't used a lot, I think with the oversight that we have going right now, I think with the Office of Child Advocate, we can live with an 18-bed facility.
Like I said, I think we were hoping for something closer to 12, but we understand there are other considerations and other people have their opinions, and 18 doesn't seem to be dramatically too high for us.
I can add very briefly. I would say, I mean, certainly we would say as small as possible, and as Keith said, I think we're hoping for something closer to 12. But I think to the point that Director Ribson made earlier, I think that ensuring that whatever kind of facility is built can be transitioned into something else, so that as the population, as the needs decrease over time, as we fully expect, as SB 14 gets more fully integrated and so on, that they can be used to fulfill other purposes.
I don't know if you need to hear it from me also, but yes, DRC would support a smaller facility, understanding that the House Bill 2 committee recommended 18 beds. That was what was in House Bill 2. We would like to see smaller, but we understand that that's what the committee recommended. And along the lines of what Jake said, if it can be used for a different purpose, then that would be optimal.
Okay, thank you all very much.
Thank you.
Ms. O'Neill.
Good morning, Chair and Vice Chair and members of the committee. For the record, my name is Moira O'Neill. I am the child advocate for the state of New Hampshire, and I will do as best I can to be brief. Number one, we're here to speak in opposition to Senate Bill 458, but we want to be clear that we're completely in agreement with closing the facility, both to benefit children and to save the funding that is so poorly used right now, but we're concerned about the pathway that this bill sets forward. I want to just point out a word of caution in terms of the stress that's placed right now on the timing and deadlines. It was over 20 years that the state of Connecticut negotiated, dealt with false promises, and finally closed their facility, the Connecticut Juvenile Training School. They did so without a plan abruptly when they finally closed. Children were treated rather intolerably for a couple of years, and they're now today considering reopening their facility. So we don't want to be in that position. To give a little context, since the spring of 2021, there have been major reforms in New Hampshire in juvenile justice. We've enhanced resources to prevent delinquency. We've created new pathways to divert children from the system altogether. And we have a plan to close the facility at the Sununu Center. That means that the census at the facility is going to continue to decline significantly. It appears that Senate Bill 458 was prompted by the department signaling that they won't be ready for the March 2023 deadline, and so they proposed to shift the plan to a private provider from the state provider that's currently in the plan. Director Ribson laid out problems with private providing enterprises, and to reiterate, given the low census expectation, Senate Bill 458 anticipates a fluctuation in census and would actually create a minimum reimbursement so that the state will be paying at times for an empty facility. In a state facility, state employees can be shifted to other roles with flexible job descriptions, including working with children in the community. Private providers may not have that kind of flexibility, certainly not to serve the state. They also have ongoing issues with workforce shortages already, and that the state has experienced as well, but the state has been able to manage that by shifting state employees in to cover in the Sununu Center right now using juvenile probation and parole officers, which private providers wouldn't be able to do. You've already heard about the changes in oversight of state facilities since the Office of the Child Advocate was established. We do have immediate monitoring happening electronically. Yesterday, as every month, we had a staff person who was in the facility talking with children, establishing relationships with them. We feel confident if they have concerns, they will bring them to us. And then in terms of the timeline of not having a program in place, by the deadline, Senate Bill 458 would move children out of state where we really believe will be particularly a problem of oversight. Today, the children that we have out of state are not visited more than 2 or 3 times a year face-to-face. We don't find that out-of-state facilities are responsive to reports of incidents and other concerns. We would be leaving children in harm's way without anyone checking on them if they go far away. And as you've heard today, they would have to be sent far because there are no options for border states providing services for our children. We do propose a couple of actions that could be taken to ensure that the state stays with its word, continues on towards developing whatever it is that has been agreed upon. Currently, it's an 18-bed facility. We, too, disagree with the size. We believe it will be much smaller. And the rollout of the new reforms in juvenile justice will tell us that in the coming year. But we also would suggest some amendments to Senate Bill 458 that would adjust staff job descriptions and required credentials experience reflecting the new therapeutic model that is proposed for the new facility. Reliance upon bricks and mortars for change to benefit children is not necessary. We would suggest that we start the new program now in the Sununu Center while we're waiting to transition to a new facility if that's what the outcome will be. We also would propose so that you codify every child admitted to the Sununu Center receive the comprehensive assessment of treatment needs and a functional analysis of behavior so they can immediately become benefit from an individualized behavior modification plans. We would suggest codifying every child admitted to the Sununu Center is referred immediately to transitional enhanced care coordination to get them back to their communities, keep them connected to their communities and family, and rapid transition to home or foster care with 24/7 wraparound services that are now newly available in New Hampshire to support them at home in their rehabilitation and to ensure that the community is safe. So by codifying aggressive treatment and rapid return to the community now, the true census of need for detention and incarceration will be clarified. In the meantime, implementation of the Senate Bill 94 from 2021 allowing assessment of needs prior to delinquency petitions being filed will be well underway with additional impact on the size of the population still requiring detention. Thank you for taking my testimony. I hope I was clear in my rush to get through.
All right,
If
thank you.
have
A lot of
questions,
this is
welcome.
in writing. I think if there are
Yes.
any questions of Ms. O'Neill, they can be asked offline.
Absolutely.
Thank you very much.
Thank you very much.
Representative Walner, you're up. And
Thank you. I'm Mary Jane Walner. I'm a state representative from Concord. And I have worked on this issue for a number of years in the Finance Committee. And I am now working on a bill that we see in front of us at the Finance Committee in the House, which is going to address the number of lawsuits that have been filed or being filed that are saying that the state mistreated children while they were being cared for at the Sununu Center. So I have to say that in the last several months, after having spent a long time hearing the testimony in the Finance Committee, I have come to believe that it's very difficult for the state to police itself. And that what we might be a model to try, and I think that's what this bill attempts to do, is that we contract with private providers to provide the care, and that the state have a very strong oversight of both the contract for the care of the children, what we expect of the provider, and that with that very strong oversight, and it being not a state-run facility, I think that in the end we will have a better outcome. I don't know that for sure because this is a new idea to try using local providers as opposed to a state-run facility. I think there are, if we go forward with a bill like this, I do think we need to write into this bill some very strong language about oversight by the state of any kind of contract that they have with the private provider. I would also like, this is a more minor thing, but I would like to be sure that within the bill, if we go with a private provider, that be a nonprofit, community-based New Hampshire provider, and that we not have a situation where we have out-of-state providers coming in to provide services here. I have noticed in the last couple of months, few, maybe longer than that, that the state does seem to be moving towards using private providers, both in our mental health system. We're recently looking at contracting with private providers to provide a lot more services, residential services in the mental health area. So I do think it's something the state is already looking at in a number of areas. And I think that Senator Daniels has brought forth a bill that looks at it a little differently than we have in the past. And I really look forward to working on it. I think it's still the bill needs a lot of work, and a lot of different ideas need to come into it, but I think that this is a good starting point. Thank you.
Thank you very much, Representative Walner. All right, the last person who signed up to speak is Mr. Gila.
Thank you, Chairman Bradley. My name is Richard Gulla. I am president of the State Employees Association of New Hampshire. We represent roughly 11,000 employees, state, county, municipal, and private sector throughout the state. And out of respect, I'll be very brief. We oppose this current legislation, and we support the department's current proposal going forth based on a lot of the testimony that you heard prior to me. Thank you.
Thank you very much. Chief Goldstein, do you want to say anything? You've signed up in opposition. I can give you 30 seconds.
No, Senator, thank you.
Okay, all right. So before I close the hearing, Joe, we need to see language on an alternative approach yesterday, okay? With that, close the hearing on Senate Bill 458. Thank you.